Just go ahead and introduce yourself for everyone so that way they know who we're speaking to, and we're just going to have our normal conversation now.
My name is Pamela Coffey, and I'm from Fort Worth, Texas area. And I started seeking help with all the chronic urticaria and hives that I have.
Awesome. So this is just going to be a little bit of a follow-up. So we're going to compare. I think it's only been I know we've been working together for about a month, but since we got all of our results back, I think it's only been about close to 2 weeks, right?
2 to 3, yeah.
2 to 3 weeks. And so we've done some stuff in the meantime. So when you first started, you essentially said that your sleep, was a huge thing. You'd get like a 0 out of 10, 1 out of 10 sleep. You were miserable. So just like kind of let everyone know the past couple of weeks, how has the sleep been? I know you've had a day or two here, but in general, the past let's say 3 weeks, how's everything been?
Well, especially the last week, I've slept at least 7 hours a night.
Okay.
5 to 6 nights in a row.
Wow.
And that's phenomenal.
And how did you used to sleep before? Like 2 hours, you said?
2 hours at a time, and then up. 2 hours and up. Never got a sound sleep. I always wondered why I never dreamed. Now I know I never got to that deep enough sleep.
Yeah, no, so now you're starting to feel better on a day-to-day basis when you start getting sleep.
Oh yeah, but I'm not so sluggish and all that anymore during the day.
So have you noticed, as I remember when we first started speaking, you're like, it's just hard for you to do any activities anymore. Have you noticed that you're able to perform more and go out and shop, and then you don't even really notice that you're starting to get tired as much anymore?
Oh yeah, absolutely. Yeah.
Because I think before you said you're like a 4 out of 10 on energy. What would you rate yourself now?
Oh, on my energy levels, as long as I'm on a good day, probably a 9 and 10.
9 or 10. Yeah, it's crazy to think within a couple of weeks you go from a 4 to a 9 or a 10. And so, most people, everyone has their own different conditions and whatnot. So you've been having trouble with the hives, the chronic hives, and also just the total energy levels. Hashimoto's, they think, they don't really know. Within 3 weeks, so you said before you used to have really, really bad episodes like multiple times a week, correct?
Oh, well, at times they would last 3 months and never go away.
Oh, so the bad episode would last for a long time.
Yeah.
Okay.
I would permanently leave bruises on my skin.
So before we started working together, there was just times where it would stay for no matter what you did.
No matter what I did. Baths, medications, antihistamines, steroids.
Okay.
Nowhere.
Everything, right? So in the past, we'll just use this 3-week example. I know we talked a couple of days ago because you had your first flare-up that was bad. But in the past 3 weeks, how many actual bad flare-ups have you really had?
One.
Just one, right? And so the reason for that one is because the body is still trying to heal itself, and typically things have to get pulled out of the system. They don't just magically disappear. I wish that's how it was. So how do you feel about yourself just, overall in general?
I'm feeling like I'm ready to start going somewhere.
Right. Okay.
I almost went to poker with my husband Friday night, and I said, let me just give it another week or two.
Yeah, and that was one of your biggest goals, is you wanted to be able to start playing poker again.
Yes, and go play cards with him, go socialize with him. And I'm glad I didn't go, because that was the night I had the flare.
Yeah.
And I would have blamed it on that.
Yeah, I know.
See, and
then you would have ruined it for us, and we couldn't have done the poker. Yeah. So you said that you were on Prevacid or the stuff for heartburn for the past 15 years. How's the heartburn been for the past couple of weeks, or past, let's say, like week and a half? I think we started working on stuff.
I'm doing the vinegar and baking soda drink every morning. It's over the last week. I've had no Prevacid and very, very mild heartburn.
Good. So controllable now.
Yes. And that's only on Sundays. Sundays like today, so far I've had 9.
Nothing. Okay. And how would you rate like your stomach? How's your stomach feel?
I guess I'm saying it feels better, because used to I would always feel like I was hungry, but I think I was dehydrated. Now
I just used to say you always mention you'd have like an upset stomach at times.
Well, I always felt nauseous, like I was pass out.
And how does that feel now?
Dizzy spells. Most of them are gone. I'm not even having them. And it's because I was dehydrated, I think.
That's part of it, yeah.
If I get up at 3 o'clock in the morning, I feel that hunger pain. I drink a glass of water because I'm thirsty, and it's gone.
Well, it's crazy though that we start working with people. We work with a lot of people on a daily basis, and I ask them questions. I'm like, well, how do you feel? They pause for a second, and they're like, I think I feel I think my stomach feels fine. They don't remember, you know, you don't remember the problems you used to have, because once you start feeling decent,
Yeah.
you're like, what are you talking about? This is how I always have felt. Because your brain essentially tricks you into saying like, no, this is how you always feel, like this. It's
Exactly.
like before you're like, I feel miserable all the time. And so
That's why I hated that spell Saturday night. I slept for a week and it was awesome. And then
yeah.
when I was up all night, I was like, oh no.
Yeah. It reminds you of like, this is what you used to be like on a daily basis. And
Exactly.
it was a struggle.
So I
So
apologize.
overall, like, the anxiety and the mood swings and the headaches, how, you know, how's all that been for you?
A lot of the anxiety and irritability is gone. It's
Yeah.
almost completely gone. I mean, I don't
Awesome.
get so uptight when I go to town,
Good.
aggravated at people and stuff.
Yeah.
I feel like I'm just in a more calm place.
That's always better, right?
Yeah.
Any headaches or anything like that?
No, I haven't had any headaches. When I went through the liver cleanse, I was having one.
Oh yeah, that'll push out a headache. But in general, the past couple of weeks, no headaches.
No, none at all.
Because literally, I'm looking at our intake that we had for getting you to perform better, and there's like 20 things marked off of you were experiencing, like just a list of them. And I'm asking you all these questions, and you're like, nope, don't have it, nope, nothing. And so, I mean, you know, I think the thing that, you know, most people don't understand, and maybe you can give a better explanation. I mean, what was the hardest part for you? Because you've probably, how many years have you spent trying to get this a little bit better, just fixed? I mean, how many years would you say you've been trying to do that?
Well, this time I've been working on it for 3 years.
3 years and no answers?
None.
Nothing.
3 years and 3 years and nothing.
And I remember this very distinctively because it stuck with me, and I was actually a little upset. I remember you telling me one thing that the doctors told you, and it really upsets you. Do you remember what that was?
That there is no cure for urticaria. Just learn to live with it.
Yeah, that there was no way for you to get better. And, you know, I would say like within 3 weeks, we haven't even started this. I mean, we're just getting into it. Like, you've gotten like a lot better.
Mm-hmm.
You know, and I think that's what people that have the same things that you have experiencing, and other things as well. We work with a lot of people, but I think that's the same answer they get is like, our doctor just doesn't know what to do anymore. And then you kind of start losing hope, would you say?
Yes.
And you give up, and then luckily, you
I
know,
was getting depressed.
depressed. Yeah.
Getting very depressed.
Yeah. And then I remember when I first met you, you're light years ahead of where you are now. You're light years ahead of where you were before. But I think that's the hardest thing, is because I meet and talk to a lot of people, and they're stuck in that same little spell of like, I don't know what to do anymore. Like, I've tried everything. And I'm like, no, I mean, you haven't tried everything. But they really think that there is no help. I mean, what advice would you give people, since you actually have been through it?
Clean living.
What's that?
Clean living.
Clean living?
Clean eating. Get rid of the toxins. I think it's all about getting rid of the sugar and the eating and doing what makes you better, feel better.
Yeah. And do you feel like what we've done for you has helped you out a lot as well?
Yeah, in week 1, the water. I saw immediate benefits. Why didn't 3 doctors? Why did none of them tell me to drink more water?
Yeah. I mean, that's a difference. I mean, I feel like we've given you a lot of answers, and I feel like the more that we work on this stuff, eventually there'll be a point where your body is finally free of all those, I call them like interferences that are affecting your body's ability to function. Essentially, once we get rid of all those, like, you're going to be back to how you were before all this ever happened. I think the thing that people forget is like, and I kid with them, I'm like, dude, you've been like this for 20 years and you want me to fix you in 3 weeks or 5 weeks, right? You know, it's like, you allowed 20 years for this to happen. You got to give me at least 20 years to fix it. Not really, but give it some time for it to get better. I mean, have you enjoyed your experience with us so far?
Absolutely. I feel like I have hope now.
Right. I remember you and I both know Dr. Mike, and he had called me up one day and he's like, yeah, I just saw her sister. And he was saying that your sister was just amazed at how different you are. And she's like, she's happier and she's like a different person. She's like, you know, Dr. Fox has helped her out. And she's so happy. She's happy with everything she's gotten so far. And I'm happy for you. Really, we're looking forward to, you know, getting more of the work done. We're in the beginning stages now. Is there anything else that you'd like to say or mention?
I'm just ready to keep going and get all better and get this pushed out of my life and get on with it.
Awesome. Well, I'm going to stop the recording. We're still going to continue talking, but I'm going to go ahead and stop this.